Alright, so for all the details on what happened to me, please see my YouTube channel, My Medical Nightmare. Alright, so in this call, you'll hear something very interesting. Many times when you deal with medical people and doctors, you'll often find they're constantly trying to trick patients when there are situations that involve doctors having to bear some sort of responsibility for errors. One of the most common tactics that I've seen in my case is they will try and make a game of the body part that's being scanned. Yeah, my injury, it shows up in my upper neck. My skull was broken. This is the main injury. But effects of this injury it developed below my skull in my upper neck. You'll hear her pull up my information and she reads something that she doesn't tell me. And then she starts talking on and on and on about the fact that I had a spine scan. If the doctor was doing his job correctly, he'll have no problem seeing evidence of this injury in the area around C1 and C2 vertebrae in the cervical area of my spine. That's your neck area, directly below the skull.
You have reached Vulcan Imaging. If you know your party's extension, you can dial it at any time. For billing or medical records, press 1. For all other calls, press 2. Thank you and have a great day. Vulcan Imaging, this is Kim. May I help you?
Hello, ma'am. I was a patient. I had an MRI scan looked at by Dr. Michael Brant Ruff of, I believe, Vulcan Imaging. But this was done for St. Vincent's Ambulatory Healthcare Network, LLC. And this was done in 2019. My MRI scan, it was misdiagnosed, and the doctor missed a very large injury in my head. And the evidence of the head trauma is about 6 inches in diameter. Infection, etc., can be clearly seen in these MRI pictures. I was told that no injury appeared in this MRI. I need to speak to somebody about having this MRI scan re-examined if it's possible.
Okay, I believe I do have, this looks like we did an MRI of cervical spine.
The injury appears in the images. And it was not acknowledged, and that's the issue. The doctor should have acknowledged the injury, and he did not.
Well, she said it was the injury to your head?
Yeah, what you can see in the MRI pictures is, and I had some other images done at St. Vincent's East Hospital, Ascension, Birmingham, Alabama. I had a couple of CT scans done before this, and in the 4/22/19 scan, there appears to be broken skull bone in the basilar area of my skull. This would be the occipital condyle and condylar canal. If you have access to those records, please look at those.
Yes, sir.
Okay.
Yeah, I don't have access to those records. The only thing that I'm showing is an MRI spine. I don't see any imaging of your head or neck.
I had the scan done. The injury shows up in the pictures. The doctor misdiagnosed the MRI. I need to have the MRI re-examined and the injury acknowledged, and it's that simple.
Okay. I just make sure I get the right information and get that taken care of, please.
Yeah, I think it's interesting. Your doctor, Michael Brant, he's an honors graduate, okay, at the University of Tennessee. And if I went to school for 10 years to do his job and become a multimillionaire, I would have no problem recognizing this injury. So why did he not see this?
Well, I'm not a physician, so I can't answer that. And I don't have access to your images, so I certainly can't address that. But what I can do is, what was the injury you said in the head that you said it was 6 inches? Yeah,
basically, you could have any freshman radiology student look at these pictures, and you'll be able to see the injury. It appears it's in my head. If you look at the whole cervical scan, you just go through it like the doctor should have done if he was a professional, and he would easily recognize my injury. about 6 inches in diameter. You can see the infection. There's some anomalous black sphere that shows up. It appears round, and in the CT pictures that I had done at St. Vincent's before this, yeah, in that same area there's broken bone. So it looks like my skull broke. The fluid between my brain and my skull, the CSF fluid, it had leaked out of this crack in my skull. And this wound, it became infected over time. And also some kind of parasite or some kind of other issue began to grow in this area. I mean, it was horrible. I almost died from this.
I'm sorry. So let me do this. Let me reach out, now that I got your name and phone number and your MR spine information. I will have someone call you.
Looks like you have many talented radiologists in your company. Please let them look at these pictures and give their opinion, because they'll identify this and it won't take very long.